Alright guys, so I am doing an update on the surgery I had. Close that. So Monday was my 6 weeks follow-up. So I saw my physician. When you have this surgery, sometimes they'll do the x-ray whenever the doctor feels like he needs to do the x-ray. Usually they do about 6 weeks out because it usually takes about 6 weeks or more for the bone to really heal. So my doctor did 6 weeks. So on Monday, when I got there, I did an x-ray before I saw him. So I do have some photo of my x-ray that I got from my office, so I'll show them. Unfortunately, for some reason, I haven't figured out how to switch this around, so I'll just have to physically move the phone. So that is one picture, and clearly you can see the screws. So when I saw this first one, I thought, hey, the screws are not that bad. They're small, not too bad. Well, I'll show you. Yeah, different story. They're pretty long. So just, pretty much that's what it's going to look like. Overall, my doctor is very happy. He took me off. There are no weight bearings, so I'm allowed to put weight on. And he also told me in 2 weeks he wants me completely off the crutches. He basically said, do what's comfortable, but make sure you're off the crutches in 2 weeks. So right now, I'm between 2 and 1 crutch. Lately, I've been doing 1 crutch. And then he said I can be out of the brace. I don't need to have the brace on anymore when I'm out and about. I did talk to my physical therapist. She's fine with it. Just depends on, say something to your doctor about whether wearing the brace when you're out and about. Since you've been off it for 6 weeks and your muscles are still weak, or you just don't have that confidence in that knee yet, I'm actually wearing the brace still when I'm out and about. That's just my choice. So ask the doctor, see what he says. If he's okay and you feel that you want it on just to protect it, don't be afraid to ask. Ask the doctor, see what he says or she says. So that's pretty much what your 6 week follow-up is going to entail. It's going to entail of your x-rays to see how you're healing, if you got the same surgery I got, and whether or not you can be weight bearing or not. Now, sometimes not everybody goes after, when they have their 6 weeks, they can, put weight on. So it varies from people to people, so don't get discouraged. The other thing I want to point out, because I asked my doctor, I was having pain in my shin, very sharp pain that went down and stuff like that, and he goes, that's normal. But don't be afraid to ask too. Everybody's different. So if you feel sharp pain and constantly and stuff, don't be afraid to ask. And then I had pain up in my quad area. For me, it was because they did an scope surgery to remove scar tissue up there. So I also have that, and that's normal. One thing I do notice about the surgery that you do have a lot of healing aches and pains. And I was told that's just part of it. It'll get better. So don't get discouraged if you're still having some pains or whatever. You're healing. So, but always try to listen to your body. Don't be afraid to ask your doctor. Pretty much that's what I do. A question is never dumb when it comes to your body. So, anyway, hopefully this is helping someone out there with this type of surgery or when it's going through this. I understand everybody's different, so if you have any questions about anything, please put a comment and I'll try to answer them as best I can. So enjoy and see ya.